former Health Secretary Jeremy Hunt says overdiagnosis of mental health conditions in young people is overwhelming the welfare and the education system, costing more than £16 billion a year. This report from the think tank Policy Exchange says public anxiety has led to a new normal, where the normal growing pains result then in medical diagnoses without sufficient and reliable evidence. They believe one of the motivations by parents for getting a diagnosis could then be because of the extra support which children then receive. One of the report's authors, the research fellow at Policy Exchange, Zachary Marsh, joins us now. Good morning.
Morning.
Tell us what you think is going on then. You suggest there are sort of maybe not the best intentions from some parents. What have you found?
I wouldn't say that it's not the best intentions. I would say that what the problem we have is that the incentives in the system are wrong. So if you, for example, you take the special educational needs system within our schools, it is possible if you apply for something called an education, health and care plan, which was originally designed to support children with very severe needs who really needed additional funding to be able to access education. Those plans actually have uncapped funding associated with them, which councils are required by law to meet. So if you're a parent who's worried about the quality of care your child is getting in a school, if you think they might have something like autism or ADHD, there's a real incentive there to try and obtain one of these plans. And one of the concerning things is, as we outline in the report, out of control, is that that's actually quite easy to do. 99% of EHCPs are eventually granted on appeal. So if you as a parent or a family really want to push this process through to its conclusion, you're likely to be able to unlock this support. And what we're saying is that across the systems, both in education, in mental health, in welfare, too many incentives are misaligned and are leading to overdiagnosis and a clogging of the gateway. And the real tragedy there is that the people who most need that support are being crowded out.
But you mentioned those parents have then had a diagnosis. So what do you believe is going wrong there? The clinicians are responsible for the overdiagnosis?
So it's two things, really. The first is, as you say, there is some concern around clinicians, and in particular in the educational space around the SEND system. There has been a large increase in private for-profit practice among educational psychologists. And it is now widely mooted on sort of support blogs that if you want to get an EHCP for your child, if you can afford to, you should pay for an educational psychologist. And while we don't have the data, it is quite likely that those private providers are writing things that are supportive of the applications that parents are commissioning. But on the other hand, the big issue really is that the thresholds set out in the legislation that governs this are just far too subjective and far too low. And it's very, very easy to build a compelling case under the current system that your child does need an EHCP or does need SEND support. And what we're saying is actually we need to raise those thresholds to once again ensure that it is the most needy who get access to this so that they get the levels of support they require. Because while the spending has ballooned, actually the per individual spending has fallen by a third in the last few years. And so the kids with really severe needs are not getting the support they need because there are too many other individuals trying to get in through the gateway.
And that is presumably because these are parents who feel pretty desperate about how their child is behaving or communicating with them. Do you acknowledge there has been some sort of shift, maybe in the last 5 years post-pandemic, that has led to ballooning anxiety and mental health issues for that younger generation?
Absolutely. And one of the things we're very clear on in this report is that there has obviously been genuine increase in mental ill health and neurodivergence in the last couple of decades among young people. And we're not questioning that. What we're saying is that alongside that genuine increase, and as you say, the pandemic played a major part in that, there has also been a rise in overdiagnosis. And as we say, there's been this kind of concept creep. 20 years ago, we would have described someone as anxious. Now we are, as a society, likely to say that they have anxiety. And that's a subtle but really distinctive change because it moves it from something that might be temporary and that, yes, requires support and we should absolutely take seriously to something that we need to medicalise and diagnose and treat. And that is not actually necessarily very helpful for young people. It's been long understood that if you diagnose a young person with a mental health condition, that's much less likely to be stable than it is for an adult just because they're going through development. That condition will change, it might disappear. And we aren't treating this with the sensitivity and caution that it needs.
We've just been talking about sort of how 22-year-olds are now unhappier than their parents, which feels pretty miserable. Sort of that should be a really exciting time of opportunity and friendship and socialising. What needs to be done to prevent what some people call as the epidemic of anxiety, which I think you're then going on to say in some cases is being misdiagnosed? We would all be better. The economy would be happier and healthier if our children and young people felt like that as well.
Absolutely. And we mentioned in the report a number of different areas where this needs to be improved. One that we talk about particularly is around social media and smartphone use. And Politics Change did a lot of work on this. Our report Disconnect has advocated for a blanket ban on smartphones in schools, and that's driving a huge amount of anxiety and mental health in young people. But there's also areas like, just encouraging more physical exercise for young people, making sure that sport is inclusive and provided for all children. A huge different array of things. And as you say, there are links to wider social angst about how young people are doing in society. We covered this in our report, Portrait of Modern Britain Youth, recently, and the need to make sure that young people feel like they have a prosperous and successful future to look forward to. And these are absolutely key elements of prevention. What we're focusing on is the fact that the systems themselves are currently not working when it gets to the point where people do try and access support.
Zachary Marsh, thank you, co-author of the report, a research fellow at Policy Exchange.